Great pleasure to introduce you to somebody who, for over 30 years, has been offering a response to HIV-related stigma from the community perspective, specifically here in Seville. She is the person who's going to moderate the session, and his name is Mr. Diego García, Adhara, Seville checkpoint. So I will leave you in his capable hands. Thank you very much, and I would like to congratulate the Spanish government and Seville City Council for organising this event, which I believe will mark a before and after in the fight against discrimination and stigma in this country and city. For me, it's a great pleasure to introduce you to a great friend and a great activist working for the rights of persons with HIV, Dr. María José Fuster. She does not have a master in methodology in health sciences and social sciences, with enormous experience in research, which has allowed her to, for example, examine results and treatments in patients, but also a multitude of studies. For example, studies that was carried out together with ourselves, which has demonstrated that peer intervention does not only improve the quality of life of persons with HIV, but also their immunological and physical health values. She's a researcher, friend, and a great woman. María José Fuster, please come up to the stage, and she is going to give us the keynote presentation. Diego, distinguished authorities, institutions, delegates, participants, friends, colleagues, I would now like to talk about the HIV-related Stigma and Discrimination challenge and the solutions that have been proposed based on the political declaration that was drafted within the scope of Spain's presidency of the EU. Since I haven't printed out the slides, I'm going to move to one side so I can follow my presentation. Stigma and discrimination has affected people with HIV since the beginning of the epidemic. And it's women who were the first to respond through our activism, ensuring that all international commitments to end AIDS were related to stigma and discrimination. Some of those targets or objectives are ODGs, and in fact, some of them focus on ending all forms of inequality, and also political declaration of the UN on HIV, which also encourages governments to implement transformative actions in order to end or eliminate the barriers which currently prevent us from ending HIV-related stigma and discrimination in human rights. And one example is the signature that we would have liked to have witnessed this morning, but we also had the opportunity to hear from Ramon about this, the global partnership which aims to end all forms of discrimination. But progress has been insufficient. There are still barriers, social, attitude-related, political and legislative barriers which are closely or affected by discrimination and stigma. Stigma and discrimination have a series of driving factors and facilitators, and it intersects with different social conditions, creating intersectional stigmas. There are different examples of this or manifestations. Some stem from external sources, such as stigma and discrimination at institutional or societal level, or stigma and discrimination from internal sources, for example, anticipated or internalized stigma. All of this is associated with negative and serious impacts in relation to access to rights and services, as well as impacts on the personal health of persons with HIV and also an impact on public health. Now I would very quickly like to run through certain evidence of HIV-related stigma and discrimination in Europe. In this respect, there are different indicators which have been highlighted or used in European surveys, which were presented in other surveys, for example, those conducted by the ECDC, etc., and also results in relation to internalized stigma, which are associated with worse mental health and social integration of persons with HIV. Persons with HIV in Europe also subjected to verbal abuse and also abuse on the part of friends, relatives, and also colleagues. And this is associated with internalized stigma, with worse health, and also worse satisfaction with life. Additionally, persons with HIV face multiple discrimination and intersectionality of the stigma, which consists in a synergy of inequalities which give rise to greater stigma that's greater than the mere sum of inequalities which comprise this. As regards public attitudes of rejection, we've also observed that there's been an improvement at this level, but there are still rejection indicators, particularly when the situation involves a high degree of proximity or contact with persons with HIV. We can also see that through different studies, it's evident that people have mistaken beliefs about transmission and believe that this can be transmitted through social contact, and their understanding of prevention is very low. There's also been progress in relation to public attitudes in key populations, but there's tremendous variability between countries. Sometimes they may be minorities in some countries or great majorities in other countries, and big differences between countries such as Switzerland or Holland compared with Slovakia or Bulgaria. Much has been said about health, and there are indicators that show that persons with HIV suffer discrimination in public health, that this is of concern to them, but this ends up in not improving their status in the health framework, and that also giving rise to delay in testing, in adherence to trials, in care provided. And we also know that there are populations or factors of vulnerability that suffer this much worse, as well as people who suffer more comorbidities because they're more exposed to more medical specialties. There's also evidence of structural stigma in the health sector, because there's no access, for example, for persons with vulnerability factors in many countries to PREPs, and no access for irregular migrants to testing and treatment services, despite the fact that we have established defined humane objectives in relation to 2035 in relation to access and prevalence. And European surveys also incorporate indicators in relation to discrimination, and anticipated stigma also deters PLHIV from seeking or remaining in jobs or applying for promotions. There's also evidence of structural stigma. For example, there are still 2 countries in the European Union that require HIV tests for entering and working in the country, and which prohibit stays or residence. In Spain, we found exclusions at national level from public employment. And although we review this here in Spain, this also occurs in other countries. It was also impossible for these persons to have access to insurance, or difficult or expensive, and this has serious implications insofar as they're unable to obtain mortgages, or foreign students with HIV who were studying in other countries are unable to study in EU countries or have access to clinical care. In Spain, as the Minister has mentioned, there have been attempts to repair the situation, to redress the situation, and since 2008 there's a prohibition of discriminating these people in the framework of the law. But this rule is not entirely effective because there are still insurance companies that don't comply with this or establish very high premiums. Although there's an international commitment to end laws that criminalise persons with HIV, for example, in relation to the criminalisation of HIV, no Western and no East European countries have laws, Western have laws that will criminalise this. 21 countries use general laws. But one thing that we have observed is that there's very low levels of knowledge relating to judicial procedures on the part of professionals in relation to key aspects such as HIV transmission, which results in unfair decisions at court level. Sweden continues to maintain the obligation to disclose the condition of HIV, and 5 countries in Eastern Europe, 2 of which are in the EU, still apply criminal laws. All of this means that according to European surveys, 28% of persons with HIV were concerned about being criminalised. Same-sex sexual relationships are legal in all European countries. However, discriminatory treatment goes beyond decriminalisation at basic level and impacts fundamental rights. According to the LGTBE survey, the compliance levels is lower than 50%, 48% for different reasons. That's the overall score in relation to EU human rights compliance. And of 27 EU countries, only in 17 is it illegal to discriminate for reasons of sexual orientation. The rights of transgender and intersexual people is also inconsistent in relation to, for example, gender recognition and also bodily integrity. And also, although UNAIDS promotes the decriminalisation of possession of small amounts of drugs for personal use, we can see that there is still criminalisation at the level of the EU. For example, in the case of opioids and also syringe exchange programmes, we can see that the limitations are fairly great. In terms of work and sexual aspects, only 11 countries have all introduced some decriminalisation measures, despite the fact that we know that decriminalisation of drug use would increase HIV knowledge and violence suppression, and also sex work could also be averting 33 to 46% of HIV infections among sex workers and their clients over a decade. Well, Europe has to act, and it must act because it has legal obligations in relation to human rights and the obligation to achieve better physical and mental health for its citizens. This is materialised in different conventions on specific aspects, which seek to reflect the foundational values of the European Union relating to human dignity, freedom, democracy, equality, rule of law and respect for human rights. And it's important for the EU to act because it's undertaken certain important international political or policy commitments, fundamentally in relation to the global strategy to combat AIDS and also the targets or objectives for the year 2025, but also a whole series of other international commitments. The political declaration proposes a series of actions so that we can get our act together. And, well, I've summarised these, but one of these would include the reaffirming our commitment to end HIV and the stigma and discrimination related to HIV. We have to implement strategies to combat stigma which are led by the community, adopting a community approach which are 100% financed. And we also have to implement the equality initiatives and policies agreed by the European Union. We also have to ensure that we ensure reliable gathering of data which will allow us to adequately monitor compliance with international objectives and adopt additional measures which include indicators to measure the quality of life of persons with HIV. We also need to improve legal protection of PHIV and also end laws which criminalise and harm persons with HIV and the exclusions which continue to prevail in certain areas. In the healthcare sector, it's important that women with HIV have access to all sexual and reproductive services, and that all of these services incorporate a gender perspective, and also ensure that there's access to irregular migrants who should have access to all types of prevention, control and care. And also there has to be access for people to PREPs, and the development of integrated health services, which will include mental health as a key component of this model. We have to promote the creation of person-centered models where patients are involved in absolutely every stage of the process. And this integration of services must ensure that all services are on board to ensure that quality of life is improved. We also have to fight against discrimination in the healthcare sector, and to do so we have to review which procedures are currently available and which measures have to be implemented in the health services sector, and provide the necessary training and also establish the necessary adaptation and penalty systems, and also promote public campaigns because of the existence of stigma through mass on public social media. It's important that we increase the proportion of HIV-related services that are community-led, and also provide support to anti-stigma strategies which are efficient. This can only be done through close collaboration of all of the key stakeholders and the involvement of MPs. And finally, in relation to education, we have to combat misbeliefs relating to the transmission of HIV and increase knowledge that undetectable is equal to untransmissible, and ensure that everyone has access to all of the available prevention models and all of the sexual education programs which also incorporate aspects related to stigma and discrimination. Well, there's only 7 years to go till 2030 and there's still a lot of work to do. So this is pressing, it's urgent, because this will benefit all persons with HIV, but it will also benefit society as a whole. I would like to thank the persons and organisations that have provided support and who've helped us in the preparation, coordination and development of this political declaration. And I would also like to thank all of the organisations that have undertaken external review of this document. But I don't want to end, although I go 1 or 2 minutes over time, without just making a personal comment before I leave. Those of us who have been living with and fighting to combat HIV, such as Diego, particularly at the beginning of this period, have seen many situations of discrimination that have been absolutely disgraceful, whether it's directly or indirectly. And we fought very strongly to ensure that stigma and discrimination forms part of the political priorities. And I could never have expected that stigma and discrimination would be at the core of EU policy, and this would actually be in Spain, and I never thought that I would be alive to see the day, and much less so that I would be the person that the Ministry of Health would have trusted me with the corresponding division, the colleagues from ECDC and UNAIDS. So I would like to thank all of the institutions that have accompanied me and all of the entities that collaborate with me in all areas of our work, and the response of the Open University Service and also my activist colleagues. For me, it's with great pride to be a Spanish activist with HIV. Thank you very much.